disposable and reusable trocars. This is called the safety trocar. You can see there is a safety wall over it and a sharp edge inside it. When you go in by putting it inside the port by clockwise and anti-clockwise motion, and you enter into the abdomen through this sharp end, and once you enter into the abdomen, it comes out. So it saves the viscera from getting damaged. So it is called the safety trocar. There are other types of trocar as well, like this one. This has an end which is called pyramid end. It looks like a pyramid. The superiority of this trocar is that when you go in, cutting in the abdominal wall, it gives more space and it splits the muscles well. Then there is another type of trocar which usually is available in the disposable ports. It is called optiport or optical port, because when you put the camera telescope inside it, you can visualize it on the screen. Everything, every layer you can visualize. So this is all about trocars. Now coming on to the cannula. The cannula has different components and different companies promote it in different manner. You can see small holes over here. When you go in, the basically the carbon dioxide gas, which is used for insufflation, goes in, and there is another hole over the trocar, and you hear a hissing sound that you are inside the abdominal cavity, right? When you are putting the second or third trocar. So it has a shaft, and there is a valve over here through which you can attach the gas to the pipe, right? And you can switch it and switch off from here. Then you can, if you open this trocar, you can see a safety valve over here as well. This is a valve which should be working well. So it, when you start the procedure, it doesn't leaks. Okay, like this. Then there is a plastic type of sleeve over here, which should be very good. It should not be cut. It should not be torn, because if there is low pressure in the abdomen, it will be very difficult to operate. Coming on to another disposable trocar, this is a 5 millimeter trocar. The mechanism is same. It has also got a safety valve, a shaft. It can be opened as well. A valve inside, flap type valve, right? And it has got a valve here to control the gas pressure. There are also 3 mm trocars, and they are smaller in length, and they are usually used in the pediatric surgery. Usual length of this trocar is 15 centimeters, but there are long length trocars as well, which we use in the bariatric procedures and in the super obese patients in other laparoscopic to another trocar, which is a bladeless trocar, and it is 11 mm, and some companies make it 10 mm. Okay, it has also got a cannula, which I told you that it is a pyramidal shape cannula. It has also got a shaft, and you can see the ridges over it right here. This is a very good trocar, but when you go in and rotate it clockwise and anti-clockwise, and you go in, it doesn't allow very easily to come trocar to come out when you are taking out the camera or taking out the instruments. On the other hand, if you use this trocar, which doesn't have these ridges, it can come out with the pull of the instrument. So you have to be careful, and you have to be static or hold this trocar otherwise. So this trocar also has a shaft, and there is a valve as well to control the gas, which is attached over here. And there are different types of mechanisms in this cannula. There is a mechanism of pushing down the button and rotating it to open it up. And here you can see a valve. Again, a valve is here, which
Dr. Tanseer, we cannot hear you. Dr. Tanseer, can you hear me?
See the entry point as well. So if you are using a reusable tocar, the thing is that you can put a 10 mm instrument inside like this. You are putting a 10 millimeter instrument inside. But if you have to put a 5 millimeter, any instrument of 5 millimeter, and if you go inside it, it would leak, right? So you have to have something which helps you to use the 5 millimeter instrument, because as we all know that the usual instruments in laparoscopy are 5 millimeter instruments, especially in the basic laparoscopy. So this is called the reducer or sleeve. You put it in like this, put a finger over it so it doesn't leak, and you can very easily put the 5 mm. Journal brief description about the ports. So I am repeating that the most commonly used instruments in the basic laparoscopy are and 5 mm ports in general surgery and in most of the gynecological and urological surgeries. And the other trocar which are being used in ports, and the some 3 mm ports are also used in the pediatric surgery patients. So there are a few more instruments which are related to this needle. This is a special type of needle which gives you an access to the abdominal cavity. So when you will be studying access, it will be told in more detail. For now, it has got a blunt end. When you go in, it automatically saves the, it has a sharp end. If you can see, when you go in, this blunt end will come out, and you will attach a gas or it pipe over it, right? So this is an important instrument. Now coming on to the other laparoscopic instruments which we usually use in the basic laparoscopy. So as most of us know, because all of us are surgeons, that this is an important instrument. What is this instrument called? It is called endodissect. This is an endodissector. You can see the tip of it. It is just like an artery forceps, angulated in front. It is also called Maryland, right? It has got a shaft handle, and here there is a revolving, reticulating type of thing from which we can rotate it, right? This is a knob for the rotation. Here you can see a thing which is metallic, and you can attach the cautery over it like this. So you can use it during surgery if you require any coagulation. The other important instruments are endograspers. So the endograspers are of different types. They can be atraumatic endograspers like Babcock's. They can be traumatic endograspers to have a big bite and strong grip. They can be single action endograspers like Johans. They can be double action endograspers. And there are some other specialized type of endograspers. I'll give you a brief account upon the endograspers with locks and without locks. In this laparoscopic instruments, also there are reusable instruments which you can sterilize, and they can be at the same time disposable instruments which you can use in a case and you can just throw them away. So here you can see this is a grasper, which is a double action grasper, and it is an atromatic grasper, right? And it is having no lock over it. There is no lock. Okay, and I'll show you the lock or the ratchet, what it is meant and what is for what it is used. So you can easily hold the bowel during the appendectomy or any other procedure intra-abdominal during laparoscopy. It has also got the area to be attached with the cautery, and there is a handle and a knob to rotate it. Now I will show you a disposable trocar with a lock. Here you can see there is a lock. It is a grasper which has got ridges, and it will be able to hold the viscera well. Like in laparoscopic cholecystectomy, sometimes you need a grasper if it is so inflamed or there is empyema that it should hold it well, and it has a lock as well. And if it is locked, you can see it cannot be opened until and unless you unlock it, right? This is another grasper without a lock, and you can see it is called a Babcock. It has exactly the same shape as the open Babcock has. You can see it is a double action one. It is also used to usually grasp the bowel. It has also a rotating knob, and you can also apply a cautery over here if required. So this is another grasper with a very sharp edge to hold instruments, to hold visceras or take some small biopsies, right? Tightly. It is also without lock. This is another instrument with lock having double action, right? Okay, this is an endocaesar. You can see the shape of the caesar. The caesar also have different shapes at the tip. Some are curved, some are straight, right? This is a reusable instrument. This is a disposable instrument. Both have rotating heads, right? And both have cautery places to be attached. Basically, it is used for cutting the, for example, the cystic duct or any other viscera like the base of the appendix, or it can be used in the bowel as well. Now, this is another important instrument which is called L hook. Okay, you see there is a tip, L-type tip over it. You can use it for cautery, and it has an end over here where you can attach the lead of the cautery. You must have used this in the laparoscopic cholecystectomy, and it can be used in almost all the laparoscopic surgeries. Okay, this is another important instrument. Okay, it is a extractor. It is 10 mm instrument. Usually we have seen it using extracting the gallbladder, right? It has also a rotating shaft and a knob to rotate it, and it can be locked as well. Sometimes some companies makes it which is not of lock, but most of the people use it locked ones, and it is usually called crocodile. You know, it opens its mouth like a crocodile. See? Okay. Now, this is another important instrument which is usually used in advanced laparoscopy, because in basic laparoscopy you are not so good at the intracorporeal suturing and knotting. This is a needle holder, endo needle holder. You can see they are of different types, right? This is the shaft. This is the lock, and you can unlock it by pressing it like this. So you mount a needle over it and start suturing. There are some companies which are making the autocorrect type of needle holders, in which you just hold the needle, it will autocorrect and will be in a straight line. Okay, now this is a grasper punch biopsy forceps. Laparoscopically, if you want to have a biopsy, you can just hold it and pull it, right? Here you can see another instrument, which is aspiration needle. When you have a very tense gallbladder like empyema, or it has thick walls and fully filled, or the stone is impacted at the neck of the gallbladder, you usually put this aspiration needle in with much safety, and then you attach it to the suction and you suck it out, the bile or the pus inside the empyema gallbladder. Okay, this is another instrument just like L hook, but it is called spatula. It has got a flatter end, like you see, and you can attach this to the cautery. So it is used in the liver bed or at places where you want to have a cautery with a blunt end. This is a very important instrument. This is called the knot pusher, right? You see, there is a hole inside it. Usually the extracorporeal knots which are tied and put inside, for example, if you are tying the base of the appendix, right? You put in the that basically extracorporeal knot and pass it through it, and then when you will push it, the knot will go in. So it is the knot pusher. So this is a brief description of some of the important instruments we are using in laparoscopy. Then there basic laparoscopy. Then there are a few things which I want to tell you. This is a telescope, which is a 0-degree telescope and 10 mm in diameter. There is I will tell you in more detail in when I'll be telling you about the lab stack. This is a 30-degree telescope and 10 millimeters. And this is a 5-degree telescope, 5 mm telescope with 0 degree, right? So these are some more important instruments usually used in advanced laparoscopy, but these days they are used in basic laparoscopy as well. For example, this is a ligashore. Ligashore is an advanced bipolar technology gadget which we use ligating the vessels and cutting them. So it has got a shaft. It is attached to the ligashore base unit, and this has got a shaft, and the length of this shaft is 37 centimeters and diameter is 5 mm. But we can also have this ligashore in 10 mm and 37 centimeters, and it has got a Maryland tip, endodisect tip. This is the specialty of this one, but it has also got a dolphin tip as well. From here we can rotate it. This is a rotating knob. From when we press it like this, it starts coagulation at the tip, and there is a special sound when it comes. The cycle is complete, we leave it and we cut it from this cutting knob. So this is ligashore, and you will learn it more in the energy devices. So this is also important instruments, disposable. This is a tacker, which is used in the hernias, right? This is an other tacker, which is also used in usually ventral hernias. This is an absorbable tacker. The previous one was a metallic tacker. Okay, so you can have a roticulating type of maneuverability with it up to almost 120 degrees, because it is difficult in the ventral hernias to tack with the anterior abdominal wall. So here you can see with the abdominal wall, it will be less difficulty when it can be rotated like this. So this is here you can see a clip applicator, which we usually use while clipping the lega clips at the cystic duct or cystic artery. You can see it. It has got here you can put the lega clips in, okay, and you just push it, and the lega clip is closed. This is the shaft of the. You can see the shaft of the instrument, and this is the knob where you can rotate it. Here, this is the handle for pressing it. Okay, Another important instrument is, a very important instrument rather, is the suction and irrigation. So it has got a shaft. This is a 5 mm suction irrigation system. It has got a shaft, it has got a handle, and there is a knob which, if you go up, it will do suction, and if you go down, it will do irrigation. And you can attach two Janker suctions or pipes over here. One will be attached to the suction, and the other one will be attached to the irrigation. And if during suction, we know that if there's some stones or something gets stuck, there is a knob which you can unlock, and you can just wash it from here, right? And you should be knowing it by yourself more than the technician. Only then, being surgeon, you can instruct people what to do. Okay, so this is another knob. If it doesn't get settled, just gets open from here, and you can take this thing out and you can wash it as well. So it was a brief description about the ports and about the ports and the basic laparoscopic instruments. The basic laparoscopic instruments usually are 35 to 37 centimeter in length. And in bariatrics in the obese patients, we use instruments which are around 43 to 45 centimeters in length. And the mostly used instruments are 5 or 10 millimeter, but in pediatric surgery, 3 millimeter instruments are also used. So if there is any question regarding the instruments or the graspers or anything, you can please ask. Let's first describing the lab stack. So this is a lab tower or a lab stack. Here you can see this is the screen or the monitor. Here you can see the insufflator. This is light source, and this is the camera CCU or the camera unit. So there are different components. One is called the imaging component, which includes the monitor, the light source, and the CCU. And the other one is the insufflator and the carbon dioxide cylinder, which we can see here. So what we do is we have got this system, which is called the insufflator, on the top always. Initially, when we started laparoscopy, we used to think that camera should be at top. But why this should be at top? Because when you are operating, you always ask, what is the gas pressure? If it is at top, you can see yourself. But if it is down there, you have to, hang up and see what is going on there. So this is basically the insufflator, which puts in the carbon dioxide into the patient. First, we will discuss about the imaging system. Imaging system consists of a monitor, and we attach our camera head. This is the camera head. Here you can see, this is the camera head. And give me the telescope, please. 10 mm telescope. This is a 10 millimeter telescope with a 0-degree angle. Here we attach the telescope, and we attach the light source exactly over here, and we attach the other end of the light source with a knob over here. Here you can see the shaft of the telescope. Here is the place to attach the telescope, the camera, the light source, and here the telescope is attached with this knob. In this telescope, there are different components. Here you can see here, right here, that you can zoom in and zoom out with this knob. This is for fine tuning of the image, right? So if you can see here in my hand, you can see that I can do a good fine tuning. If you can show them on the monitor, right? Like this. Okay. So before you start with your procedures, you should first of all do a white balance. Here, if you can show them the buttons over here. So you press this button once, okay? And then with this button, upside and downside, to show the monitor, you press it to the white balance, and you just push it once, and there is written white balance is okay, right? So you may proceed doing your procedure. Okay, hold it like this. This is basically a knob which you push in to start with the scope. Okay. Now we will come to the insufflator. In insufflator, this is a switch on and switch off button. Okay. Here you can see a start button, and this is a stop button. So if you are going to start it, you just press it, and it will get started. And you can hear a hissing voice. Give me the this pipe. Yeah. This is a connecting pipe where which you attach over here, like this, and the other end to the trocar once it is inside the abdomen, like this. Okay. First, you do an anti-clockwise and then a clockwise maneuver, and it will get fit. And you open this, and you can hear a hissing voice. If there is any obstruction like this, the pressure will go up over here. Okay, and it will give you a alarm as well. Here you see the pressure is going up, and it's giving an alarm. It means there is some obstruction or the valve is off. So you will check it. The usual pressure we keep in the abdomen is 14 or 15 millimeters of mercury, and which should be less than 19 to 20 millimeters of mercury. Okay, and I'm stopping it. Here you can see the flow rate. You can start with a low rate, then you can shift it to the medium, and then to high rate. Okay, and you set the flow rate up to 14 or 15 or 16. And this is the area which will show you what is the flow rate in liters per minute, how many liters per minute is going inside the abdominal cavity, and what is the volume, which it can be shown here, right? And I have told you if the tube is obstructed or if the valve is obstructed, these values will go up. And if during the surgery, if there is some cardiac problem or the anesthetist, he requests you that do not have more pressure, then you can just reduce pressure like this up to 10, 9, 8, like this, okay? Okay, and you can increase it from here as well. So this is about the, and this is a switch on and switch off button, right? This is how to use it. But when you are starting it, there are some important things to do. And if we go back of this tower, we can see that there is an insufflator which is attached with the cylinder which is attached with the insufflator, and you need a knob to open it and close it before and after the procedure. We have power supplies to all our insufflators, camera head, and the CCU. Basic and the light source. The basic issue is that we should be aware of these things as well. That's why I'm telling you at the end of the presentation that you should know how to attach these, right? And if we see that this is a system which is attached to the camera head, and the other knob VGA is attached to the LED. Then we have recording systems at the back and the outputs at the back and in the front as well. I will tell you at the back here, there is the S video out, S video in, and on the front side, I will show you that there is a USB port for recording as well. So we should know how to attach these and how to attach these with the power supplies, and they should all be attached to a good quality power supply unit at the back of the wall. Come on the front side. If we see a little of this light source, here you can see that it has got a switch on and off button. Here is a button to control the intensity of light, a knob like thing. And there is a port where you can insert the light source cable in. This is basically LED light source, but on the other hand, there can be xenon light sources as well. So this is a CCU or camera head unit. This has got a switch on and off button. Then this is basically the camera head knob, which is attached into this socket, and then we have a USB recording system as well. And we attach any USB over here, and we can record our system from. You can show this from this button. If you keep this button pressed for a while, it will start recording. Okay, you can see record video here. You can show that here, and when you want to take a picture, just click it once and it will be stopped, right? Okay. Now at the end, we will, stop it like this, and we will gently detach all the things so they can be secured. So this is about the lab stack. Now I would like all of you to ask any question regarding the graspers, regarding the ports, regarding the patient or the lab stack.
Can you hear me? Dr. Imran, can you hear me?
Yeah, I can hear you, Dr. Tanseer.
Have you heard?
Excellent presentation, definitely. And hopefully it will be very fruitful for our viewers, and a great message from your side, especially someone who are going to start laparoscopy, because in this session our target is also newcomers and someone who are just now going to start laparoscopy, or due to this we have this session of basics of gynae laparoscopy. Dr. Tanseer, so much thanks for your presentation and excellent. If someone have any question, you can ask in chat, and at the end our faculty member will be available and they will answer.
Thank you very much, Dr. Imran.
Professor Atif?
Yes, I have shared the screen.
Okay, sir. Professor Atif will continue intracorporeal suturing.
Yeah.
That is very important.
Yes.
And,
So
suture,
here
there is no future.
I will be beginning from where I stopped, and I hopefully that this screen was shared. And now you can see that the leftmost picture, you are doing an ipsilateral